According to a new firearm fatalities and hospitalizations report, suicides make up 92% of gun-related deaths here in Maine, with 87% of those deaths specifically being men. Here with us to talk about what people should know and how families can respond to this is Sweetser's medical director, Dr. Mark Kaplan. Dr. Kaplan, great to have you here in studio. So when we're talking about what's important for people to know when it comes to firearms and mental health risks, what's the most important thing?
Well, the most important thing, again, is what you just said, that suicide, death by suicide from guns is the most lethal form of suicide, and it's the most prevalent for suicide death. And men, unfortunately, are most likely to kill themselves with guns. So when someone is feeling overwhelmed and distressed, especially a man, having that firearm inaccessible makes it ever so dangerous.
Does it surprise you that firearm suicide overwhelmingly affects men?
Not at all. Now, first thing I want to say is there's nothing wrong with owning a firearm. Nothing at all. When you're a depressed person and really bottling up that emotion and there's a gun there, that's a bad combination. So you want to make sure that a man doesn't have access to the gun at that point. So loved ones can help them by locking it up, by talking to them about that, because if you don't do that, the chances of an irreversible bad outcome are more likely to happen.
Sure. So if someone's going through a stressful or emotional period, what can they do to reduce the risk without giving up, say their rights or their freedoms of owning a firearm?
Yeah. So we want them to get help. Now, men are less likely to want to share their feelings, go to a therapist, anything like that. Mm-hmm. So when you're a loved one, you have to really know what to look for a person depressed. So you're going to look for see your loved one is withdrawn, is talking about hopeless things, is talking about no longer being alive. That's a warning sign to remove that gun from them and to get them help. If you have to call 988,
That's okay.
The Suicide Crisis Prevention Line in Maine and around the country, please do it. Okay? You'll save a life. And if it's not as severe, you can coach them, love them, and maybe get them to go for some help, whether it's their family doctor, whether it's coming to a Sweetser Hope and Healing Center in Brunswick, Stamford, and Lewiston. Don't wait. Remove the gun, work with them on that. They can have their gun when they're feeling better. You may have to use the yellow flag or red flag law. And remember, that will temporarily remove the gun from a person that is suicidal.
Right.
But they will get the gun back when they're well.
Okay. So let's say somebody is watching this right now at home and maybe they're struggling, or maybe someone close to them is struggling. Where should they turn?
So again, they can call 988 to get immediate help from crisis people. They can go to one of our Hope and Healing Centers. They can go to emergency room. But maybe they have to work with getting the gun removed. If they have to do that, they can call the police. They can call anybody to enact that.
So lots of resources out there for help.
There really is.
Okay. Dr. Mark Kaplan from Sweetser, thanks so much for coming in today, and thanks for all the work that you guys do. We appreciate it.
Thank you so much for having me.
Of course.